Force majeure language, that act of God language, have everyone out there who's got a wedding or a big event take their Mr. Magoo glasses out, look at that closely. 2 words, force majeure, and then frustration of purposes. This is a question I'm now getting like 6 times a day, Cheryl. Should the company pay for it? What if they've shown no symptoms? To be candid with you, I'm going to say something a lawyer doesn't usually say. There's not a good legal answer yet because it's so new.
My biggest question in this is this. I get concerned when the government's picking winners and losers.
With emergency room doctors, that over 53% of them, their biggest fear is getting sued. The ACO model is completely counterintuitive to that.
I have a sister-in-law who passed away 2 years ago of Down syndrome. Medicaid was supposed to be for individuals with Down syndrome, with autism, the most impoverished among us. No, Obamacare expanded it to what I call deadbeat dudes.
Aetna pulling out of 17 markets is a dramatic and significant move.
I was not surprised by the decision because, let's be honest, the Supreme Court said we could write a book on near-death experiences over Obamacare. They've tried to resuscitate this thing and make sure it doesn't go to the light now 3 times.
Healthcare providers don't understand it. And I think that's what we need to start with, is educating. It's something we do at Genco and I do in presenting to companies.
Obamacare took away pre-existing condition rating. Eventually, those premiums are going to explode.
And we've got Congress out there going, what do we do with our health care? They could over-lawyer this thing to the point where they end up hurting Americans.
For our folks out there that are having these events, forget the contract. If you put people's lives in danger, there's a concept called torts. Ultimately, if that person catches this coronavirus, COVID-19, because they went to an event that you had, the people going to spring break or whatever, you could be liable. So do the right thing ultimately for public health. As a lawyer's advice, that's going to be your best medicine right now.